good afternoon or good morning to some people. Thanks for joining HALC's live programming again. It's we hope you're all staying safe and healthy, especially given the subject of today. But it's our honor to be joined by Professor Economides from NYU Stern School of Business, also a longtime member of HALC. And one of the best promoters of Greece during the crisis, and just an expert in so many things. We posted his resume, and we're going to get to a lot. Now, Professor, thank you for coming. I'm glad that despite you very much being for the second time in your life at ground zero.
Well, good afternoon. I'm glad to be here.
I'm glad to see you safe and healthy. Now, despite your illustrious resume, one of the things you're not an expert on is medicine, but you've been great at analyzing, and I urge people to follow the professor on Facebook because he's been great at analyzing the trends with the coronavirus crisis. And so many people are looking at numbers and modeling and not interpreting them correctly. It's been almost a breath of fresh air and a source of reassurance to get your analyses. You predicted when you were analyzing the numbers and predicted when the peak was going to be hit in New York, and you've been reporting some good news. So can you walk us through what you were looking at and what your conclusions are? Especially for New York. We'll get to the nation a little later, but for New York.
Sure, Andy. Okay, the first thing is because you hear many different numbers. The first thing to keep in mind is that the crucial number is the number of new hospitalizations. Because incubations, intensive care, deaths, and so on are all based on that. So the number of new hospitalizations, and this is a number that New York State Governor Cuomo announces every morning. So what we have seen from this number is that in the first 10 days of the announcements, there was a geometric or exponential growth, very fast curve going up. And then from March 25th to April 3rd, about 10 days, the numbers were fluctuating around the same number, a number close to 1,200. That's 1,200 new hospitalizations every day, and sometimes it was a bit above, sometimes it was a bit below. And that was going on for 10 days, up to April 3rd. And then April 4th, April 5th, April 6th, the numbers are very, very significantly lower than 1,200. One day the number was 500 something, the other day was 300 something, the other day was 600 something, but way, way below the 1,200, which means that the stay-home measures have started working. They have a lag to work, but they started working, and now we see the good effects, because when there are fewer people hospitalized, there are going to be fewer deaths. So we're going to see this in a week or so, that the number of deaths is going to fall also dramatically, since now we see the new hospitalizations in New York State fall dramatically. And it's really very unfortunate that we have so many deaths and so many hospitalizations early on. But the great news is that the measures of staying home and social distancing have worked, and we see the actual effects, the actual extremely positive effects in New York.
And we've seen similar trend line in Italy, and obviously, best of all, where we've seen it greatest success is Greece, and we'll talk a little bit about Greece later. But I also want to caution people, and I think you've been striking this note of caution. You're reading the numbers great, but what you just concluded is the stay-at-home policies and the lockdowns are what's positive.
Yes.
And I think some people
Yes.
are taking the wrong lesson, and they're thinking, oh, it might be time to start opening up. What do you have to say to that line?
Well, that would be a disaster. I mean, we saw what was going on in the first 10 days before March 25th in New York. There was a huge increase in the number of hospitalizations, the number of deaths, the number of people in intensive care, new admits to intensive care, new ICU, and so on. So we need to avoid that. I mean, it doesn't seem so hard to stay home. I mean, it's a sacrifice to stay home, but at the same time, think of all the misery and the deaths that you are avoiding by staying home. So it's very, very important to keep doing this and keep doing this for some time. Now, for sure, until the end of this month and possibly longer. But that decision, how long, is going to be up to the leaders, the president, the governors, and so on. So it's too early to say. But right now, for sure, the best policy is to stay home and keep the distance of 6 feet, the social distancing. And if you have to be in a place with other people, use precautions, put a mask on, make sure you minimize those kind of occasions as well.
Yeah, and I want to invite all our viewers, anybody who has a question for Professor Economides, you can type it in the comments and we will bring your question up and ask it. But Professor, you talked about for sure until this month, and you talked about, when we started seeing the effect. One of our disadvantages as the United States is that major states, and I'm going to point out particularly Florida, Texas, and Georgia, and especially because they're travel hubs, delayed. They only this last week put on their social distancing measures. Does that mean the nationwide peak is going to be extended? There's different models. There was a report. There's this model from Washington that says we may get to the peak sooner. There's other models that later. But how disastrous or how negative was this kind of delayed implementation of nation measures?
Yeah, delays, even of a few days, can make a big difference. In New York, for example, there was a delay in closing the schools for, in my opinion, minor reasons. I won't get into that, why they did it. But, and this delay was 3 to 4 days. But even that delay have costed in suffering and lives. So it's very important to close down once you know that you have some people infected in your community. And each one of these communities, like you mentioned, Texas, Florida, and so on, they know how many people, more or less, they have infected. So it's very important for them to do something similar to what New York has been doing right now. And not only New York, California has been very successful, and other states have been successful in having much fewer cases than New York. So it's important to start with this. And then I guess the major question for me as an economist is when would be the right time to end? Because at some point in time, we are going to end these restrictions. As I said before, it's extremely unlikely that we're going to end before the end of this month. But the question for the government, and both the state government and the federal government, is when should we lift these restrictions? And I think that there are crucially two numbers that the government needs to be able to make this decision. And these numbers are, first, how many people are actually infected? Let's say in New York, how many people are actually infected? Now we really have no idea how many people are infected, because practically speaking, the only people who are tested are people who show up in the hospital with some symptoms. And out of them, about a quarter have the virus and 3/4 don't have it. But we haven't made a random sample of the whole population, something like an opinion poll, to find out how many people are infected. So that's something we need to do. And that's something that the government can do right away, because the test is there. It only takes 1,000 tests per region, like an opinion poll. It's not such a big deal for it to be done. The second thing we need is how many people have passed the disease and now they have antibodies and are immune from it. And that might sound like a detail, but there is some evidence in New York that at least 25% of the population, people believe, have passed the disease and they don't know about it because the symptoms were nothing or so small they thought they had a cold that it wasn't such a big deal. Now, to do that, we need the antibodies tests. And my understanding is that there are a dozen of those tests that are being tested. The tests are being tested by the government to find out if they are effective and if they have a small margin of error in the results. But we need to do that as well, have a random testing and find out where we are. Now, additionally, some people have suggested if we have this antibodies test, we should make a much more wide testing, not just do it on 1,000 people to see where we are statistically, but go ahead and test 100,000 people or 200,000 people and find out where if each one of them has passed the disease or not. And that would be useful, because if somebody has antibodies and is right now immune, then that particular person can go to work without any particular losses for anybody else.
You know, so those are numbers we really got to watch, and which means that there has to be a speeding up of testing and getting it out. I think we're still testing. It's really a shame that we're lagging behind the rest of the world in testing, but that's something hopefully that's going to be sped up. But let's go to your main area of expertise, the economy, because there's other numbers that we got to look at. The story came out today that the Congress and the administration are kind of in agreement in yet another stimulus package. Speaker Pelosi threw out maybe another $1 trillion. What are you seeing as both the scale of the potential economic disaster, and what measures have been taken so far? Do you think they're going to be able to stem losses or keep us afloat and prevent a depression?
Well, I think that we told people to stay off work and stay home. So automatically, lots of businesses have been put on pause. So it's not surprising that suddenly there are millions of people unemployed, and in fact the total production of the country is going to fall dramatically, has already fallen dramatically, and will keep being down during the second quarter being this quarter that we're in. So we expect that this quarter, the total production, gross national product is going to be minus 20% at least. And it's likely that in the next quarter, we can also have a minus 20% again. Now, the present stimulus has been tailored to deal with this minus 20 for 2 quarters, because the present stimulus is about 10% of GDP. So if you add up the minus 22 quarters and 10% money given out, then you will have about an equal counterbalance. Nevertheless, it is conceivable that the losses in GDP are going to be larger than 20%. And therefore, there is a discussion of a third stimulus. And also because there was a lot of demand for the small business loans, much more than the government expected, and therefore the government needs to give more of those. So there is a discussion of a new stimulus of about $1 trillion, which is going to be specifically geared to this crisis. And there is also an additional discussion of putting in the big infrastructure project that has been discussed for years now between the president and Congress. And one of the good news, I should say, in this situation is that despite the acrimonious political fights that we have observed for the last 3 years, it looks like that this kind of, there is a degree of cooperation between the political parties in that issue.
So in the next, as they're looking at this next stimulus package, or maybe one after when the economy opens up, are there measures that you haven't heard discussed yet that you would like people to, you wish that were on the table?
Well, I think the major measures that I could have thought of are there. The crucial thing is to take care of people who have become unemployed, to take care of businesses that have no more income, such as restaurants in New York, for example, to, generally speaking, increase demand. One of the things that is driving the crisis right now is that people feel apprehensive. They don't really know how long this is going to take, how bad the economy will turn out to be. So in those kind of circumstances, people think of the worst scenario, and they tend not to make purchases, not to make the usual purchases. So of course they go buy groceries, maybe they buy even more than that than usual, but they don't go buy a car. They don't, obviously they don't go out for entertainment because they're staying home. So there are sectors, big sectors of the economy which are hurting. The entertainment sector, the airlines, and then the luxury sector, the durable sector. These are big sectors of the economy. So what the government is trying to do now is to try to create a situation in which, as we come out of the crisis, suppose at some point in time, let's say the middle of May, the government and the state say, well, let's open the state. And the open is going to be probably a partial open. It's not going to be a full open. There are going to be some people staying at home, and that would happen after widespread deployment of tests, so we know who is who in terms of testing, in terms of having the virus and having passed the virus and so on. So suppose that it happens, then it's important from a psychological point of view for the consumers, the average people like you and me, to feel comfortable to buy a new car, to buy something not an absolute necessity. So the government is trying to give money to some extent to people to actually do that.
Stimulate the consumer spending.
Yes, stimulate the consumer. Yes.
Before we move on to Greece, there are some questions that I think probably better answered at this point. Aristos Constantine, he's talking about containing, the containment measures flatten the infection curve, but steepen the recession curve with, as you discussed, not only the economic harm from GDP, but personal suffering. What do you think for how long can lockdown measures be sustained?
Well, I mean, okay, first of all, we see that measures working. So fewer people are admitted to hospital, fewer people are dying. So that's important. which means that for the moment, or at least for an extra month, the measure should be sustained. And once we have more evidence and more testing, especially the test of the antibodies, which will tell us who has passed it, then we can seriously open the discussion of slowly opening up.
Yeah, I think your discussion about the testing before was key. Konstantin Flavaris asked, what do you foresee with the differences between the U.S. and other countries in terms of quality of measures happening with contact between countries? As we open up, and other countries are already opening up, will travel bans remain? Will they need to remain? What do the trend lines show you? Or maybe testing makes a travel ban solves that issue as well?
No, I'm afraid that testing doesn't solve 100% that issue. So that has to be also examined in some detail. And there is some experience in China where they have reported in the last few weeks that most of the new cases they have are from travelers from abroad. So we have to look at that as well.
Konstantina Duvis talks about, and she may have missed earlier the conversation about the antibody testing, and you talked about, at the very least we have to do some sampling, but obviously, and I think the professor said this before, the best would be to be able to do large-scale testing, especially on the antibody front.
And I should say that this is not my specialty, but my understanding is that this kind of antibody tests, once developed, are easy to replicate and produce, so you can, within a couple of weeks, get into widespread testing.
And they're also not as difficult. I mean, I've been reading a lot that they're not the nasal swab that you have to send out to they're kind of a prick on the finger that you could get almost immediate results. But that's also something that, as a matter of public policy, governments have to prioritize and get there. Sure. And frankly, I think people who are getting discharged from hospitals, they're donating blood so we can build the research in terms of antibodies. Katerina Dimitratos asks, which government organizations have acclimated to this environment well? Who should be our example for going digital and assimilating to our new reality? And what do you think the long-term impact of such digitization efforts are? Because that's one of your expertises as well.
Yeah, I didn't talk about the digitization effort. I talked about two things. One, the random sample in the population of these two tests, and also widespread sampling for the antibodies test. Now, there is a third method which has worked in Korea, which was essentially the following. The government testified, once people have been tested, whether somebody has passed it or not, and kind of gave them an ID, if I could put it that way, something on their phone that said something like that, and at the same time allowed this ID to be seen by others in the population, and therefore know if it's okay to contact this person or not. And somehow this thing has worked in Korea. Now, I actually think that might be something positive and something that could work. I'm not so sure if it's going to work in the United States. People respect a lot their privacy. I'm not sure if that's going to be applied in the United States.
Yeah, we haven't even gotten the real IDs. We just got the real IDs rolled out. So you're right. A national ID card has always been very controversial, but that may be the easiest way to solve this. Alexandros Papadopoulos says even after the lockdown is lifted, the business and especially the small business sector will continue to bleed as people will be insecure and still socially distance themselves as much as possible. Of course, we've already heard reports that the restaurant industry, the entertainment industry, they're planning when they open to do every other table or every other seat. At what percentage do you foresee unemployment rising? And even when we open up, I'll add to this, even when we open up, how slow is the ramp up going to be?
And that's a hard question to answer. And I think that will depend. I think it will depend on the mentality of the people. So it might be different in New York or in Chicago or in Texas. I also think it will depend on public confidence. Right now, the confidence of the public in the state and federal government is pretty high. And we see that most people, or at least 95% of the people, are following the advice of those governments. Now, if we end up, if 2 months from now, let's say, we have the same extent of confidence on the government, I would expect that the ramp up of business could be pretty quick. But it remains to be seen. And it depends from place to place. The only place where we have seen a ramp up was China. And China is quite different than us. So it's difficult to extrapolate from them.
Angela, I guess this is more of a comment, but when you talk about what's not being bought, she also points out that people are not buying homes. And this is a key. This is the beginning of the kind of residential real estate season. And frankly, as we're thinking about recessions, it's all real estate in the United States has very much led the way out of recessions. So problems on that front, maybe especially difficult, right? And so far, though, the good news is, and maybe as a result of what we learned from the last crisis, the banking sector and the financial sector haven't seen that much of a problem, maybe because of the reserves, the additional reserves. We don't have a liquidity crisis yet. And of course, the SBA programs, a lot of this stimulus is meant for banks to get money to their customers.
Absolutely. Yeah, the Fed has been taking a lot of actions, and it has intervened in a whole bunch of markets. And that has been, even from the first days, even before a week before the stimulus package was approved in Congress, the Fed had already taken most of the measures of providing liquidity to the market, and in practice, endless liquidity to the market. It's just when asked the Fed chairman, how much money are you willing to put in buying treasuries, he said, an unlimited amount of money. So we are lucky that the Fed exists. When we see what's going on in Europe, because something similar to the Fed does not exist, they have much bigger problems than us.
When you're talking about unlimited responses, Alexander Thomopoulos brings up, I think, a question that's on point. How will the government balance federal aid to the states, stimulating the economy post the corona crisis, and preventing massive inflation and making a debt crisis unavoidable?
Okay, so that's a lot of questions. First of all, the relationship between the federal government and the states is complicated. The states, of course, always ask for more, and sometimes they ask for much more than they think they can get just to get something. But the states are also going to be hard hit in terms of tax revenue, and the federal government, because we're going to have a recession. So not only is the federal government giving a lot of money out, which means that its debt goes up, but also it will have a significantly lower tax revenue this year in 2020. So that will show up in the debt, and the debt is going to be significantly larger when we get out of this. But I think practically everybody agrees that we don't have an alternative, and that's the only thing we can do. And it will take decades, really, seriously, it will take decades to be able to get back to the old debt levels that we had in the beginning of this crisis. But we don't have alternatives. And as I said a minute ago, it's at least very comforting that we have the Fed and it's able to intervene. And because the United States prints its own currency, essentially it prints trillions of dollars as we speak to be able to get us out of the government. If we were under a constraint, like we didn't have our own currency, for example, we would be in much worse shape.
You know, which that's a perfect transition point to talk about something we're all concerned about, and that's Greece. First of all, I think we're in agreement here. The Greek government really deserves a lot of kudos for how boldly and quickly it moved.
Absolutely.
How it flattened the curve. But even more importantly, defying any and all expectations. Just a few months ago, people were saying, "Oh, Greece is so behind digitally. It's in the 19th century. It's not even in the 20th century." And the methods that they use to enforce the stay-at-home order, the Minister of Digitization, Pirakakis, has done unbelievable. People have to issue an SMS message to the ministry to get permission to go out. That allows people to track who's going out, get better information about where a hotspot may emerge. And as a result, Greece has had numbers that, frankly, should astound us all.
Absolutely. I think it's a great success of Greece and, of course, the present government, the Prime Minister Kyriakos Mitsotakis. It's a great success for them because the Greek health system is not the best in the world. So the fact that they have managed to take the measures so the system doesn't get overwhelmed is absolutely a great success. And the fact that Greece is doing much better than other European countries, much better than Italy, much better than Spain, much better than France, Belgium, and so on, is a huge success for Greece. And hopefully they will keep it up and they will end up okay. I mean, much better than the other countries in as far as the disease is concerned. The problem for Greece is the economic problem, because a big percentage of the economy is tourism. Not only hotels, but also Airbnb and people spending money in restaurants, tourists spending money in restaurants, and so on. So that has disappeared, and it most likely will disappear into May, and it might disappear in the summer. So if that happens, then suddenly the extent of the recession in Greece becomes much worse than the last big economic crisis. Yeah. So I'm concerned. I'm very concerned of larger numbers than the ones I mentioned for the United States. And we can talk about them. People in Greece don't talk about them because they're so bad. We can talk about them in the United States. I mean, I'm concerned that the GDP might fall 30 to 40% in the second quarter and something like 30% in the third quarter. These are huge numbers. And if they turn out to be the case, before, of course, any intervention, if they turn out to be the case, then Greece will have a worse year than any of the previous years of the economic crisis.
And you were one of the leading analysts during the crisis with a lot of ideas, and you still like right now, today, the finance ministers, the European finance ministers met to discuss Euro bonds. You're not poo-pooing them, but you don't think that's really a solution for Greece. Can you tell us what may the Euro bonds do for Greece, but what does Greece really need, especially from Europe?
Well, Greece needs money. I mean, it doesn't matter if they're going to be called Eurobonds or anything else. It needs cash, and it needs it to come from the European Union because it's very unlikely it's going to come from anywhere else. So Eurobonds is an old idea, something that has been discussed for over a decade, but it has problems because it equalizes the risk of different countries. And that's not right. I mean, Greece has much bigger risk than Germany. Italy has much bigger risk than Germany. Portugal has much bigger risk than Germany. So when you ask for Eurobonds, essentially you ask the Germans to give you a gift in terms of giving you money that are not appropriate for your level of risk. So they say no. And that's not unreasonable that they say no. So at the same time, it doesn't mean that there couldn't be other money that comes from the European Union. And I should say also there are some various legal reasons and other reasons why the Eurobonds are difficult. But because of the crisis, the previous big financial crisis, the European Union has set up the ESM, the European Stabilization Mechanism. And the ESM has been a godsend for Greece. The money that Greece owes to the Europeans are essentially money owed to the ESM, about $250 billion. Okay, so what you can do is take this ESM, this organization that is run by Regling, a German who lives actually in Athens, but because most of the money goes to Athens anyway. So take this organization and make it be the one which is going to distribute money to the various European countries, including Greece. And the way the ESM runs, it doesn't distribute real money. It distributes guarantees. It goes out to the financial markets, borrows money, and then gives guarantees of money to the various countries. And this has worked well now for Greece, Portugal, Cyprus, and so on and so on. So they can do this for the whole European Union. And that seems to be the most likely thing to happen. What exactly is the amount? We will see. We don't know because that's going to be discussed and bargained about. So hopefully this is going to work, and it's going to work this week. And then starting next week, Greece will receive some money from this mechanism. Now, given the extent of the recession that I mentioned before, Greece really needs large amounts of money. So we'll see if what the ESM gives is enough or not, because of the special case of Greece relying so much on tourism, which is going to fall.
You know, on that point, and we don't know yet how much tourism is going to fall. I think that was your point there. Yanni Tsakalos has a question about the bounce back in Greece, but is there something from the trend lines, because you're looking at all the charts, all the flattening of the curves, is there anything that gives you a basis to predict when tourism may come back?
Well, for tourism to come back, it's not enough for Greece to have no cases. People have to feel comfortable also in their home country. They need to feel comfortable to get in a plane from Germany and come to Athens, or from the United States and come to Athens. So the question is, from which countries are people going to feel comfortable? And the countries that are going to be most comfortable from are the ones that have already made a full recovery or almost full recovery. And the only one that we know that has where this has happened, well, there are actually 3 or 4, Taiwan, China, Japan, South Korea. So these are the countries that are way ahead of us in terms, or ahead of everybody else in terms of doing a recovery. So these tourists from there are going to be the first ones to come to Greece. But also Greece has to be out of the woods. And as we just said a few minutes ago, it's doing great. And hopefully it continues to do great for another month and then reassess the situation with the same tools that we discussed for the United States, the test for antibodies, the test for the virus, the widespread test of antibodies if possible, so that we will know who can go to work.
You know, we're coming up to the end of our episode here, so I want to get to some of the last questions. Evan Karambelas had two questions. I think you answered the type of stimulus Greece needs and might get. But his general question, this is kind of globally, what permanent changes may we see in the global economy, in the way the economy functions?
Well, one thing we're going to see for sure is much more use of digital tools because all of us are at home and we work digitally from far away. This will not go away. It's not going to go away at all. So it's kind of an evolution. So people will think of ways that this can happen, and we might even venture to some, like I say, the university right now, I'm at NYU. In the university, we have converted everything to digital classes. Now, when this thing passes, let's say in the fall semester, are we going to do all classes in the old-fashioned way, or are we going to do some digitally? So digital things are going to be more important. Also, maybe not going to the grocery store. One thing that has happened in reality here is that we end up ordering many more things online or from the grocery store to be delivered. So that might stay. There are other kinds of behavior as well. I'm afraid that also at the end of this crisis, not all businesses are going to recover. We might have some restaurants closing. We might have some retailers which were not doing so well closing because for them 1 quarter of bad sales or no sales is horrible. So because they were in bad shape to start with. So we're going to see these changes. But if I can say if there is one kind of fundamental change, it's going to be digital, and the other one is going to be being a bit more global. Now, this is a global threat, and it was really unfortunate that it started in China, and China was not telling the full truth for some time. So that's an issue, and we need to strengthen worldwide organizations which, let's not kid ourselves, are not usually staffed by the best people. Yeah. So we have to really the most efficient people. I mean, not necessarily best in other areas, in other dimensions. So we have to really strengthen the global organizations and being able to take into consideration things that happen far, far away from here, but might end up costing us a lot. And that's something that somewhere in the back of our minds, I think, is in every leader's head.
You know, one Constantine Flavaris makes, there's reports out there that the pandemic's effect are being disproportionately borne by the poor and working class. Here in Chicago, actually, yesterday we saw a report that 40+% of our fatalities are African American, even though the population is nowhere near that. We've just started seeing we've started seeing grocery store workers get the virus. 2 Walmart workers died yesterday in Chicago from the coronavirus. What is it going to mean, you know, both kind of from a grander economic perspective and to certain industries, if low-income workers make up the majority of these deaths?
Well, that's definitely a very sad thing. I should add to your data on that. New York City released data of cases by zip code in New York City. If you know the zip codes in New York City, the overwhelming majority of the cases happen in relatively poor zip codes with low income. It is a problem. It has been a long-run problem of digitization that the digital economy requires fewer workers in general. Because a lot of things are done by computers and by artificial intelligence and so on. You don't need workers. But the ones you need tend out to be unskilled, like the ones that you need in large numbers, not the ones that Google needs, but the ones that Amazon needs in large numbers, or Walmart, are large numbers of poorly paid, unskilled workers. So that problem existed for the last 5 years at least, and people had not addressed it yet. But I think as we go through this pandemic, and actually these poorly paid workers are essential for us because they deliver our groceries, then we need to think about it much more, about creating economic solutions to get around that. And I have my ideas, but I'm not sure if you have enough time in this program to discuss them.
Well, I really want you back because I think we're going to get to the point, hopefully, and we'll be watching your charts. And again, I recommend that everybody follows the professor's commentary on trendlines. But I think
Facebook.
On Facebook.
Yeah.
I think we're going to get to the point, and maybe here's your open invitation. You're a regular guest on our podcast anyway, and our briefing calls. But I think we'd like to have a discussion about the next stimulus package, and as we get more information about when openings may occur, I think your analysis will be even more relevant. But the final two questions, so maybe you can take us home with this, but Christina Vasilatu, this a little bit, again, you alluded to some of this. How do you evaluate Larry Kudlow's statement that the U.S. will open up in 4 to 6 weeks? And then Nikos Piperis, are you worried about the inflation and devaluation of the dollar after not only this stimulus, but as you said, there's more stimulus coming?
Okay, let me talk about the first one. A lot of these statements might be aspirational. Now, the president had said, I want to open by Easter, which is, Catholic Easter this week. It doesn't happen. It won't happen. But it's aspirational. And I think that Kudlow is similar. So I wouldn't necessarily say just because Kudlow said it, it's going to happen. It's just a wish. Now, in terms of the dollar, that's a hard question because what has happened in the crisis and what has happened in every crisis is that no matter what problems the U.S. economy has, everybody perceives around the world that they have bigger problems. So what happens because of that is that money flows in to the United States. Now, when so much money flows in the United States, bond yields fall, and they have fallen dramatically. Even a couple of weeks ago, they were extremely low. Now they have stabilized a bit. Okay, so what does it mean for the dollar? Well, when the yields on the financial instruments, the bonds, are so small, then the dollar tends to go down. Now, sometimes it doesn't go down. Because why? Because the other countries have bigger problems than us. And people say, how can Britain be in better shape than the United States? Let's make sure that the dollar is more valued. But in the long run, if I can give a good answer as an economist, the long run will depend crucially on how high the bond yields end up at the end of the crisis. And at the end of the crisis, remember, we will have a huge accumulated debt, which we'll have to service. And because of that, it's possible that interest rates are going to go up. And if interest rates go up, then the dollar becomes stronger as more money comes in the United States. So it's difficult. It's early to venture into that discussion. But generally speaking, if I'm talking about a year from now, I would say that the dollar is likely to be stronger and interest rates are likely to be much higher than what we see right now.
Professor, I see on our screen that a lot of journalists have joined us. Greg Pappas from the Pappas Post sends you a thank you for keeping us informed. But because we have these journalists, and I think at the outset you talked about the trend line, and you talked about the trends are going in the direction we want because social distancing is working.
That's true.
But, since we're both of the Greek American community, and whether it's because of the Easter coming up or the weather getting better, there are some people who are trying to say the trend line proves that we can go to church for Easter, or we can go take communion 10 people at a time, which I think they're learning the wrong lesson. And I just want to take the program out with what you told us at the beginning. What is the trend line showing, and what's a lesson that we should take away?
Okay, the trend line, the number of new hospitalizations going down in New York shows that social distancing and staying at home works. There is really no other reason for this to be happening. So it's crucially important that social distancing remains in place and staying at home remains in place. Now, I understand the desire of religious people to go to church, but if they see the leaders of the church, like the Archbishop, the Patriarch, have already created a setup in which the priest and the cantor can just be in church and do the liturgy, and everybody else watches it online. And that, in my opinion, is a great solution. It allows for everybody to participate in real time in the mysteries. So it's not going to hurt anybody. If we did the opposite thing and everybody went to church, not only it would hurt them, but it would hurt their relatives, their friends, their acquaintances. It would create a new wave of infection, which clearly they don't want to do. So clearly we want to avoid that.
And I think one of the things that you said just now, social distancing, part of the social distancing is staying at home.
Absolutely.
Right?
Absolutely.
Stay at home is the key thing. Social distancing is for when you must go out, but staying at home. And frankly, as you said, the church has taken measures to make liturgy available. And beyond that, we see here in our metropolis, the Metropolitan does 2 Facebook Live events, discussions with other clergy and theologians the way we're doing. He does that twice a week. Priests are doing messages every once in a, maybe every day on the internet. So there's a way for us to stay connected, stay at home, and stay safe. And I wish you continued safety and health. We're going to probably ask you to come back on in the next couple of weeks and analyze the next stimulus package and more trend lines. We wish all our watchers and all our followers and our network and beyond and their families good health, safety. We will be putting on more programming next week, just as a little bit of a commercial. Next week, we are going to do the real history of Constantinople. As you know, you all responded to some bad research done by National Geographic, and we got that pulled down, but we're going to have tremendous programming next week, including Dr. Elizabeth Prodromou, Dr. Young Kim from the University of Illinois, and many others. And then the week after that, we will be in conjunction with the Greek embassy in D.C. doing a online celebration of the 2,500 years of the Battle of Thermopylae and Salamis that will be headlined by Professor Paul Cartledge from Cambridge and Professor Barry Strauss from Cornell. So we look forward to having you all in these and many others, including Professor Economides' repeat. We're going to have three-peats from you. I think we'll be thinking about this for a while.
Well, I should say, we stay healthy and we stay at home.
Thank you. And Eric Hill and Dean Abdalis, I've gotten your comments about my new haircut. Yes, I like it too.
Take care. Stay home. Thank you.